Hello, everyone. Welcome to another episode of Seco Direct. My name is Dr. Tiwa, and today we're going to talk about something that is really impactful to older men as regards to their health, and this is prostate cancer. Prostate cancer. What is prostate cancer? What do we need to know about prostate cancer? How do we get prostate cancer? What what is vital to understand what can lead to prostate cancer? What are the things that we need to look out for prostate cancer? How can it be managed? All these things are more are what we are going to learn about in this episode of Seco Direct. And I hope you stay entertained with what we're going to tell you today. Thank you, and let's get on to the episode. All right, first of all, what is the prostate that is getting the cancer? What exactly is it? So the prostate is a small pea walnut sized shape ball that is attached or around where the urine comes out from. So the urine comes out through a pipe called the urethra. But around it is what we call the prostate. Now, that prostate is what is affected. It's just below the bladder and in front of the rectum. Now, that prostate produces a fluid that is part of the semen that comes out during excitation, for instance. But that prostate itself can get affected with cancer, especially in older men. Now, what happens when this prostate cancer occurs? This happens when the cells that make that prostate gland grow uncontrollably. We know what cancer is. Cancer is mutation of cells. So when a cell continuously mutates, when I say cell mutates, it means it acts differently from what is normal. Let's say there are 10 balls in a basket, and then there is a colored green ball inside that basket of white balls. Now, if you keep shaking that basket of 10 balls, that green ball will affect all the other balls in that basket where they have stains of green on them. So that's just an easy or simplistic way of talking about what mutation is and how cancer cells can rapidly grow. Now, 29% of male cancers are prostate cancers, and this is increasing in Africa. And we have to also notice that in Africa, we are not a society that is proactive with healthcare. So this is even just 29% of reported cases. There are people that are out there that do not know that they have prostate cancer. Now, what are the risk factors that we need to look out for when we look at prostate cancer? First of all is age. That's the strongest risk factor for prostate cancer, because men that are 40 and above are more likely to have prostate cancer. And at the age of 50, once you get to 50 and above, it increases rapidly. Race is been stated by some notions that African American men are more liable to have prostate cancer. Family history. If there's a family history of prostate cancer in your family, you need to be careful and know that you are at high risk of having prostate cancer. This type of prostate cancer is usually called the hereditary prostate cancer. Now, if you have 3 or more relatives, like father, brother, son, or you have family members with prostate cancer in your last 3 generations, or at least you've had 2 family members with prostate cancer at 55 or younger, you need to understand that you are at risk also of having prostate cancer. What other factors can actually affect you having a likelihood of prostate cancer? Environmental factors. If you live in societies where there is a high fat diet, if you are eating food with a lot of calories, this is most especially prevalent in like Nigeria, the southwestern part, for instance, or in America, where there is the obesity epidemic also. If you have a sedentary lifestyle too, that can also be a risk. When I say sedentary lifestyle, I mean someone that does not do a lot of moving around. History of smoking too, as there are links that have been seen for it to be linked to prostate cancer. So how do you know you have prostate cancer? Now we might not know because there are symptoms that are similar to other things that affect that part of your body, like BPH, which is benign prostatic hyperplasia, or protectis, when there is inflammation or infection of the prostate gland. Now, there's usually a symptom. There's usually a symptom chart that you could go through where there are things like dribbling of your urine. Dribbling means the urine coming out one. Urinary incontinence, when you're unable to control urine coming out of your body. If you have hesitancy, you being hesitant to urinate, or if you have to strain to urinate, or when you urinate you have like a painful or a burning sensation. Other symptoms that can be there is if you urinate and you see blood, or if you feel like there is pain occurring at your back or in your hips or your upper thighs. In the early stages, normally prostate cancer does not usually have any symptoms, but if you're looking towards the later stages, you can see symptoms that have been stated above. Now, how do we know? How do we look for, or what test needs to be done to understand that, okay, prostate cancer is a likely possibility? There is a particular test called the prostate specific antigen, is the PSA. Now, that, if it's the range, usually shows, okay, there's something wrong with the prostate. It's not a definitive point at prostate cancer, but it's the definitive of something is wrong with your prostate. So if something unusual is found during screening, you can then do further tests like doing a biopsy where a small sample of your prostate tissue is taken just to determine, okay, is it cancer that we're seeing here? And if it is diagnosed, what stage of cancer are we seeing? So when we now get to treatment of what prostate cancer is, that depends on several factors. First of all, how fast has this cancer spread? Has it metastasized to any other part of the body? How's your overall health? Where was it diagnosed? Was it diagnosed in the early stage or the late stage? Because that will put us in the position of what type of treatment would be best. For instance, chemotherapy is something that is usually done for most cancers of anywhere. And also we can have active surveillance therapy, hormonal therapy, or a combination of all these treatments will also be advised or be looked into depending on what has been figured out regarding the staging of the cancer. Now, living with any type of cancer is challenging, including prostate cancer, because resources and treatment plans are continuous and for a very long time, and they usually have a very bad impact on your overall health as well as your mental health. So it is very important that you let your healthcare team know about all of these your concerns, and it's also very important to have a supportive system around you, because with every ailment, even as little in our climate as malaria, you need people to be around you to support you, to make sure to understand that you are not going through all of this alone. And with cancer, having that supportive system is very crucial, so that you know that the regular checkups to go to have, and also to know the type of lifestyle you need to be engaged in to make sure that this whole process is not as strenuous as it's meant to be. Now, before we wrap up, let's go around with the key points that we need to understand. Prostate cancer is affecting a small ball around our urethra of where we pee, and it is very essential that we do regular screening so that it is caught early. We need to understand that it has symptoms that are similar to other things that affect the prostate, but then a biopsy is one thing that we need to do to make sure that we can stage and know where we're at if it is actually cancer. If you or any other person you know has been diagnosed with prostate cancer, treatment options are available like chemotherapy, hormonal therapy, active surveillance therapy, and different things that have already been stated, including a combination of all these therapies have already been stated to know, okay, this is what I want to do. And lastly, when it comes to cancers, prostate cancer, especially for men about 40 or 50 that are usually affected by this particular type of cancer, having a support system is very crucial for everything, to make sure you maintain the proper lifestyle, to make sure that you also go to your healthcare provider. Because with men, unfortunately, men usually are not as guided about their health as women. So it is very paramount that you get people that will make sure that you do the things that need to be done regarding your health. Till we get to another episode, if you have anything that you want to ask from us, please make sure to comment and make sure to drop comments down below. Take care. Remember to be proactive with your health and prioritize your health. Until next time, I remain your host, Dr. Tiwa, and thank you very much.